So we'll look at another congenital issue. When they say congenital issue, it's basically something that you were giving birth to with. All right. So diaphragmatic hernia is just quite simple. So normally your diaphragm should be competent. Your diaphragm should be as competent as this to hold back all these organs in your abdomen. But if you are having your diaphragm breaking up, so organs from the abdomen are going into the chest, that's what they call the congenital diaphragmatic hernia. So just so you know, it's a serious birth defect. There's a hole in the diaphragm, so the abdominal organs like your stomach, your intestines, and liver, okay, they are moving from the stomach right into the chest cavity during fetal development. All right. So this crowds the lung and heart, often leads to underdeveloped lungs. Of course, they are coming to compress the structures in the chest cavity. So the structures in the chest cavity, they are not having that freedom of space to be able to develop properly. So it often leads to underdeveloped lungs. That's pulmonary hypoplasia, right? And there's high blood pressure in the lungs. That's pulmonary hypertension. All right. Lungs is for breathing. So that's to tell you that this gives a lot of issues to people that have it to be able to breathe well. So causes and risk factors is most times causes are unknown, but it's linked to genetic mutations or syndromes like trisomy 13, 18, 21. May occur as an isolated defect or with other anomalies like heart defect or neural tube defects. All right. So diagnosis is what prenatal ultrasound, all right, fetal MRI, and echocardiography will access the size of the lungs, liver position, heart function. All right. Observe to expected lung to head ratio. This one helps to predict severity. So symptoms after birth is all they have breathing difficulties, just like I told you guys. Right. Organs from the abdomen are coming to the chest cavity. Of course, they are compressing the natural inhabitants of that place. So there's cyanosis because of low oxygen delivery. There's a barrel shaped chest, concave abdomen, vowel sounds in the chest. So sounds that you're supposed to hear in the stomach are now in the chest. Why? Because you have organs from the stomach going to the chest. So treatment is immediate stabilization at birth with breathing support, because the main problem of a patient with this is breathing difficulties. Surgery to remove the organs. Okay, to move the organs back to the stomach. All right, and they also do a surgery where they actually put a mesh. They cover the weakened area. All right. Then in severe cases, extracorporeal membrane oxygenation may be needed to support heart and lung function. So that's it for this concept as related to baby diseases.